I am Dr. Mike Milligan. I'm here with Dr. Uchi Odiatu, a dentist from Canada who's also a fitness and nutrition expert. And we're going to talk about dentists now moving into lifestyle, talking to their patients about the whole oral systemic connection, how the mouth affects the body, which also involves lifestyle things such as nutrition, exercise, and those things. Uchi, thanks so much for being with us.
Hey, I'm glad I can share my energy and information with you.
And he has a lot of energy. Tell us a little bit about Uchi. Well, first off, some of the things that you and your wife have done in Canada, the fitness awards you've gotten and all.
Well, it's just fantastic. I've been able to blend dentistry. I'm certified as a trainer in 2 different organizations. My wife is a former Ms. Fitness Canada. She's Ms. Fitness Universe. Again, the neat thing about her is people always think that she was born, with a six-pack, but she was overweight as a child, overweight as a teenager. Wow. And didn't make a claim and said, I want to be healthy. When she graduated from the University of Manitoba, I was going to become a phys ed teacher. So at that point she said, I need to get healthy if I'm going to be a role model. And if I'm going to be an authentic communicator for these kids, I need to get my own house in order. Right. So planting the seed then of taking care of yourself as a teacher. We think the word dentist, the root is doctore or teacher. Take care of your own house first before you can translate that message and help your patients.
Right. And now dentistry is moving into overall health in a big way for many reasons. But tell us a little bit about how dentists, why and how they're moving into nutrition and exercise with their patients and the importance of that.
Well, you talk to dentists, especially if you've been out and practicing, 10, 20, 50, 30 years. Right. They often see the big picture. When you first get out of school, you're doing fillings and crowns and you're looking at the minutia. Yes. And as you get going 10 years, 15 years out, you get more seasoned and you realize there's more at stake than just how nice your crown looks. And you start looking at the patient as a whole person rather than just putting these nice little fillings in this body, then wondering why a year later it doesn't look so good. And I think we're now starting to look at it earlier instead of 20 years out. We're trying to get dentists getting excited about looking at the whole body earlier. And I think patients are starving for someone to care about them, looking at the whole systems rather than just this organ, this tooth, that tooth. So I think dentists are getting it, and I think patients are appreciating this newfound enthusiasm to looking at the whole body.
Oh, absolutely. And typically your physician model is the treatment model. Once you're already diseased or sick, they're so busy doing that. Whereas dentists, historically, we try to prevent disease, and we focused on that. We treat it as needed, but prevention is the key. We now know that periodontal bacteria, gum disease, travels through the whole body and creates all kinds of systemic problems. We know that sleep apnea does as well. So we're getting into more of the overall health of the body, and we're able to help patients with those things. So what should our patients know about nutrition and exercise? That give us 5 or 6 key things that they should do and that the dentist should help them with.
Well, I think in the past, again, nutrition was looked at, this is good for getting lean, this is good for your mouth, this is good to keep your mind young and prevent dementia. Now realizing what's good for the mouth is good for the heart, is good for the brain, is good for the body. We shouldn't stop compartmentalizing it. So I think patients need to know that if you have an anti-inflammatory diet or the Mediterranean diet I love, if a patient's going to lose some body fat, excess body mass, they're going to decrease their inflammatory load. If they're concerned about inflammatory diseases, which is almost chronic inflammation is the source of so many diseases in the body. When you look at hepatitis, pancreatitis, gingivitis, periodontitis, colitis, irritable bowel, you name it. And anytime a patient can lower their inflammatory load, whether by losing weight, whether by flossing and brushing twice a day for 2 minutes, whether by getting proper dental bridges and crowns and implants fitted nicely so there's less irritation and inflammation. So anytime a patient can decrease their inflammation, they're much healthier overall. Their vessels, there's 63,000 miles of blood vessels in the body. The blood can go through easier without the nicks and injuries that you'll see with high blood pressure and high sugar intake. So all those blood vessels run through the mouth. People often wonder why the gums are pink and the lips are pink. And I said they're not pink. They're only that color because the blood is surging underneath them. It's that fine. So if your mouth is going to be not healthy, it has an intimate connection with the 63,000 miles of blood vessels. It's not just run under your tongue, through the brain, through the pancreas, through the heart, through the kidneys.
Now, nutrition and what we eat versus exercise, which is more important, and how do you combine the two for maximum? We're all busy. We have so much time. We like certain foods that aren't good for us. Give us a few tips on how we combine the two and what we can do in a short amount of time, exercise-wise, and a little bit about the nutrition we ought to be doing.
Okay. Great question, Mike. I know we're all busy, patients are busy, dentists are busy,
right.
Families, we got community commitments, lifestyle commitments. Many of us want to know what's the most effective use of my time.
Right.
And I keep telling them it's a 50-50 game.
Okay.
And then I'll get a dentist saying, I own 3 offices, I really have a hard time making it happen. What's more important, diet or exercise? I'm like, you got to do both. I get patients saying, I'm a mother of 4. Do I need to lose weight and then exercise, or do I exercise and I lose weight? I said, you're making it too complicated. You got to partner with these things.
Mm-hmm.
You know, if you're going to exercise your body and break down tissue during your workout, and you want to rebuild it and fuel it, if you're eating Pop-Tarts and beer and pretzels, you're not going to get good fuel, and you're not going to get good building blocks. Mm-hmm. So you got to combine exercise with the proper nutrition, which is the proper amounts of the macronutrients, protein, carbs, and fats, essential fats, ideal, good fruits and vegetables as carbohydrates, good free-range beef if you want to go with the meat route, and chicken and fish.
Mm-hmm. They're okay.
Hydration. Oh, they're okay, for sure. But you got to blend it all together. And you can get a PhD in nutrition and still not understand it. Mm-hmm. So it's all about not just, knowledge is potential power. Sir Francis Bacon said knowledge is power. Mm-hmm. Knowledge being potential power is, how do you activate it? And one of the best resources is your dentist and your hygienist, because we're actually trained in nutrition. We understand the mouth-body connection. We can blend the two. We oftentimes have more time than your average healthcare provider to spend with patients. Mm-hmm. So it's really a nice partnership now to get not just the mouth healthy, but the whole body healthy.
What about supplementation?
I'm a big believer in supplements. I used to think you could all get it all from food. Well, in an ideal environment, if you're living on a farm and you have free-range chickens and eggs and meat, and you're picking your apples from the tree. But nowadays, apples come from hundreds, maybe sometimes thousands of miles away. They're kept in storage containers. They're delayed ripening. So by the time they get to you, many times they're full of chemicals and pesticides and herbicides and fungicides. Right. So I think also with the aging population, I heard the other day that 1/6 of the population is over 65. And as we get older, we're less likely to be able to absorb the nutrition. So if you have holes in your diet from processed food, holes in your diet from being over 50, holes in your diet from staying up late and burning the candle at both ends, you need ideal nutrition. And sometimes that will have to come from a pill or a capsule or a liquid. Okay. So I'm a firm believer in a good whey protein powder to supplement for muscle growth. I'm a fan of the multivitamin. I'm the fan of antioxidants. So I love all the different antioxidants. I'm a fan of good water. I'm a fan of taking essential fats, because not all of us can have fish twice a week. Right. So taking an omega-3 or essential fatty acid supplement daily is mandatory.
I do all those things, and understand the importance.
Well, you're one of the 1 in 7, because only 1 in 7 North Americans eat the recommended omega-3 every day. So 1 in 7. So the other 6/7 are deficient. And omega-3s are fundamental for hormone growth and anti-inflammatory influence. So there's some really good stuff going on in nutrition, for sure.
Oh, there is. Any last things you'd like to tell our patients and the audience before we close?
I think it's really important to look at your body as a whole. I think it's very important to seek out the best people in your community to help you. If you want, you want the best chiropractor. You want the dentist who thinks in the broadest perspective. You want a medical doctor who agrees that there is another way to help you other than treat disease. How about prevention? You need good family support. You need a good trainer. You need to have good sources of food. You need to demand more of your grocery store and ask, where are these vegetables and fruits and farmed animals coming from? And then I think we can all get healthy together, and it's quite a beautiful mix indeed.
Well, wonderful, Uchi. Thank you. Now, the last question is, where can we get more information about all of this? Do you have a website?
I do. It's fitdentist.com. Okay. So fitdentist.com. I used to weigh 225 pounds. I used to be fatdentist.com.
Oh, okay. My goodness, yeah.
So fitdentist.com. My wife and I wrote a book together. It's called The Miracle of Health. Okay. It's available on Amazon. It's an easy download. HarperCollins has arranged it all. I'm on the road sharing my energy with people that matter.
Right. Uchi, thank you so much for being with us.
Hey, thank you.